We now start with our the scientific program, the first panel discussion. The first panel discussion is titled Impact of COVID in Clinical Practice. Are we now prepared for the next wave? For this panel discussion, we have the galaxy of super specialists and the confluence of such eminent and distinguished doctors is basically a very rare occasion for us. We are very proud to have all of you with us, and it is a very rare privilege to be in the midst of all of you. This particular panel discussion is going to be moderated by Dr. Mukesh Mehra. He's MD DM, Consultant Department of Medicine, Max Super Specialty Tertiary Care Hospital, Delhi. You will have to excuse me for compressing the CV of all the faculties, because your contribution has been so exhaustive and intensive in your respective domain that if I were to basically go through the entire CV, I will run out of my breath. And I basically want to continue this particular session until the last moment. So I hope you will excuse me for this. Dr. Mukesh Mehra is MD FRCP Glasgow, FRCP Edinburgh. He's also a postgraduate in diabetes from the Cardiff University, UK. He has delivered more than 200 national and international lectures and web deliberations, and he has many national and international publications and associations as investigators in clinical studies. May I invite Dr. Mukesh Mehra to the dais. The next faculty member is Dr. Alok Agarwal. He is a senior consultant at Gangaram Hospital, Delhi. He is an active participant in teaching programs of DNB students. He is an expert in microsurgery of ear and in functional endoscopy in sinus surgery. He was a president of Delhi AOI during 2017-2018. May I invite Dr. Alok Agarwal to please join us on the dais. You are already here. Thank you. Our next faculty is Dr. Govind Makharia, who is a MD DM. He is a professor of gastroenterology and human nutrition at AIIMS. He is a medical researcher with a total of 299 publications, including the book chapters. It's a humongous work that Dr. Makharia has turned out. He is associated with the World Gastroenterology Organization for global guidelines on diet and gut. His editorial experience as advisory board, clinical and translational gastroenterology. He published approximately 300 publications, and he is having reviewership of almost 30 top journals, which are peer-reviewed journals like Lancet, like BMI, American Journal of Gastroenterology. And he received the Best Paper Award not once, 10 times. And moreover, and this is something very singular contribution of Dr. Makharia, he also applied for 9 patents, and all the patents have been granted. Our next faculty is Dr. Rajesh Shawla. Dr. Rajesh Shawla is MD, FCCM USA, FCCP USA. He is a senior consultant respiratory and critical medicine, and he has also an expertise in sleep medicine. He is attached to Indraprastha Apollo Hospital, New Delhi. He has a European diploma in intensive care. He is a past president, Indian Society of Critical Care. He is a past president, National College of Chest Physicians, and past chancellor, Indian College of Critical Care Medicine. May we have the pleasure of Dr. Rajesh Shawla to please join us here. Thank you, sir. Our next stellar member of this panel is Dr. Rajesh Rajput, MD DM, Senior Professor and Head Department of Endocrinology, PGIMS, Rohtak. He has to his credit 150 publications in various international and national journals, and he has written various chapters in the textbooks. He also was awarded by Economic Times in June 2020 as the most inspiring diabetologist, endocrinologist. He also basically is a gold medalist by AR Set Gold Medal for the best research paper in ASICON in 2007 and silver medal for best poster presentation in ASICON in 2010. He is the president of Indian Thyroid Society. May I invite Dr. Rajesh Rajput to be part of this panel, sir? Our next panelist is Dr. Pankaj Watts. He's a well-rounded personality. He is MD in AIIMS, Delhi, and LLB. He is a medico-legal expert. Dr. Pankaj Watts is a postgraduate in forensic medicine from Department of Forensic Medicine and Toxicology, AIIMS, Delhi. He is also a law graduate from MD University, Rohtak, and is having very vast experience of 34 long years in medical and health sector in government as well as private health sector. He has worked on almost all the positions in various health institutions run by the government of Haryana for 26 years. May I invite Dr. Pankaj Watts? Thank you, sir. And now I hand over the session to Dr. Mukesh Mehra. Thank you, sir.
Thank you, Mr. Joshi. I think first I will like to actually share my experience actually. So my journey in medicine when I moved to Delhi started in 1987 or the first week of January 88. And the first man I met was Colonel Chopla, and he introduced me to Dr. K.K. Agrawal. It was January of 1988. It was the first time, just after finishing my MD, I met the man with bubbling knowledge and the very overconfident man and never tiring guy. So my first interaction, the clinical, was with Dr. K.K. Agrawal. He interviewed me twice in last so many years. They're all available on the YouTube and different platform also. And I'll share one experience actually. There was the first night, that was my night duty actually. So it was at 3 a.m. he called me. Mukesh, you have to come with me for a patient. So we got a call from Railway Hospital for a patient who required pacemaker. So at 3 a.m. he was with me. He finished round at around 11:30 in the night and then came at 3. Whole night he was there, stabilized that old elderly lady, the Kashmiri lady, I still remember. And then moved next day, gone his home and came back right at 9 for his OPD and echocardiography. That's the only place which was doing color Doppler echo, and I was with the NC Nanda program and all that. I was associated in organizing one conference also, but I left out 3-4 months later. So he was, as a lovely man, he was a guide, he interacted with me many times. So I had a very small incident also. Remember, Ms. Agrawal would know that in January or sometime that time you had some fire in your home and you lost some, I think, precious things. But he did not miss his OPD. He came for his work and all. I was so influenced with that man. So this is just my experience with him. So leaving aside, and we missed him. He was not only, he actually made our presence in every house in the country. So when in the COVID time, there were 3 types of opinion. One is an international opinion coming from expert, one is WHO guidelines, and third, after All India Institute, it is Dr. K.K. Agrawal's opinion, which has been actually, we had to face every time, whether it's an indoor patient or it is an OPD patient. So, his influence was so extensive. So now we will move on to first topic actually, the impact of COVID in clinical practice. Are we now prepared for the next wave? So so we'll start with how our personal life was impacted during COVID. As far as my own opinion goes, presently the impact in daily life is extensive and has far-reaching consequences, especially we healthcare people. Because challenges in the diagnosis, quarantine, treatment of suspected or confirmed cases, high burden of the fluctuation in the existing medical system which we have seen in the recent times, and overload on doctors and other medical professionals, and overloading of medical shop, requirement of high protection, and affecting our economics also, our social life also, closure of places of all kinds of, whether entertainment or disrupting all celebration, religious festivities and all. So, so my first question, I start with Dr. Alok. We know that COVID-19 did not spare anybody and it impacted everybody's life. I'm sure it must have impacted your too. How did your personal life change after the advent of the COVID-19? So what is your actually personal experience regarding effect, which may be professional also, it could be social also, economic also. So how do you take and what is your expertise on that?
To speak very truly, it started with Gali, right?
Yeah.
Gali to whom. Then desperation, it was desperation and we abused what has happened, what happened. Then emptiness, khaliness. And then came Modi ji and Thali and Tali.
Thali and Thali. Yes.
And that gave a boost to everybody. Not only the normal population, but we too doctors. We realized that yes, we are important and we have to do something for our society. Not to just sit idly in our house and do the normal things. And we started then giving the lectures on the phones and the social media and educating the people, social distancing and everything. So from desperation, we moved towards this thing. This was in our personal life.
So it was a huge desperation for all of us actually. We all faced that challenge. It was a high burden of patient also and overloading of all kinds, and because of patients' high expectations also, our family expectations also, and we had a tough time, or I think we have got slight relief, I think, till the time, if we escape third wave, I think it is good for all us professionals. Dr. Govind, I'd like to ask you about, did this COVID-19 cause you to discover some new patients in your life which hitherto remained latent and which you discovered during this time when you have been isolated from your active clinical practice and you have been forced to confine at home? So did you discover some new patients or just try to revive your old habits and old hobbies and all that?
Thank you so much, and my gratitude to Dr. Agrawal that he left a big message for all of us to follow. So taking your question that how COVID, certainly COVID was a difficult time, but it also brought a lot of opportunity. And one of the most important opportunity brought the power of, say, online teaching. So I'm a teacher. I teach at AIMS, New Delhi. So I've always wondered that how do we engage all the trainees, say in my field like gastroenterology, because in our society, like inside the gastroenterology, we do a program called YCP, a Young Clinician Program, where we call all the trainees for 3 days and discuss important issues in gastroenterology. But we thought that how do you maintain this, how to connect all through? And this COVID brought this opportunity to do online teaching. And that was, I think, is a big passion, which I want to do it, but now we can do it because of this opportunity of Zoom and other platforms. Second thing was that we did multiple master classes in gastroenterology, inviting all the gastroenterologists and trainees, and a series of multiple classes. Now we're also doing second phase of that. There's a master class phase 2, where we're talking clinical case discussion with all the trainees. So I think the COVID brought a lot of good opportunity to us, and so the power of the online discussions, what Dr. Agrawal had been doing for his patients during COVID times. So this is a wonderful thing to happen to us.
Yeah, that's wonderful. Actually, we all, being clinicians, actually, we enjoyed that part, actually, that webinars, interactive sessions, telemedicines, and all that. Rajesh, which was a new patient you discovered during this epidemic? Actually, you have been a very busy, I know you've been not only busy, you were a super busy man and had a lot of pressures also, VIPs also treating all those patients who are being shifted. Even I happened to interact for a few VVIP patients, extremely busy, although still you had some time in the initial part when even the admissions were restricted. You were not supposed to even move out of house initial day. So did you also discover some new passion or just revived your old hobbies and all?
Thank you, Mukesh. Not really. Actually, I had practically all through the pandemic no time. Used to start at 7 and finish at 11 because the critically ill patients, I was the first one to go in, the first critically ill patient who was admitted in Apollo in 26th March. And after that, setting up new ICUs because it was much more problematic in the second surge. The first, I still had time because the number of patients was not that much. So, but I did not discover, we were just, because you see, how to treat these patients was a problematic for all of us. Steroids, they were effective, came little later. And how to save them, because we lost a lot of patients during that time. In second surge, although, the total number of patients we lost was much more, but we could save many patients out of the ventilator, which we were not able to do in the first episode.
It was a learning stage for us. We learned during this time.
Yeah, and our time was, most of the time used to pass in teaching the students who were taking care of these multiple ICUs, and then seeing the OPD patients. Because Apollo 24/7, there was a online, so I had to see patients also.
Yeah,
so it used to be 10 o'clock. So I could not pursue any passion, but I enjoyed working during pandemic and taking care of these patients.
So even this new passion or even the more involvement with patient care, I think that is you always been a very intensive clinician, always busy with critical care and also heading many associations also. You keep organizing also, and I recently also saw you are again busy with the same old habit of some international conference you are going to organize or some national, very recent with the chest physicians also. And there's a critical care, the forums
Not during this period, but I have been doing earlier.
And just a common question, how did your family respond to these challenges affecting during COVID-19? How was the response of the family?
It is always advantageous when your wife is a doctor because she can understand much better. She was very supportive all through. And the family, without family support, I think none of us can work. And there was a good family support and everything because, during this period, there was a lot of uncertainty in minds of everyone, whether you were busy or you were free, because a lot of people had surgeons, they had a lot of time, but in the second surge, they were also involved in the patient care.
Yes, even
because
we were all directly exposed to the patient. We are the highest patient with the highest risk. So that's why the family was
and,
apprehensive all the time.
Many
Our
of the
welfare also.
clinicians getting affected by the COVID-19, and there was a scare. But then, you know, what I realized all through, and still I feel the COVID appropriate behavior, we should continue for a little more while. I mean, people have stopped in the city of Delhi, and the mask and the hand wash and little distance.
Yeah.
We should continue
Very,
for,
very
I think,
important.
till November. Probably then, probably we might be through with this.
Dr. Rajput would like to mention regarding your did you discover any new passion or just
Well,
happen to?
yeah, thank you very much. First of all of us are discussing that when they met first Dr. K.K. Agrawal. Actually, I does not remember when I first met him, but I remember when I last met him. Before COVID pandemic started, it is actually CSI, which was organized in Delhi, where I was invited to deliver a lecture, and there I met with Nilesh. I do not know whether Nilesh is remembering or not, along with Nilesh in exhibition hall. So that was my last meeting with Dr. KK, and after that, obviously, all of us have gone into COVID pandemic. Coming back to what you have asked, actually. Now, honestly speaking, if you say hobby-wise, yes, I have developed a very interesting hobby. I have developed a hobby to de-learn what actually I used to believe I know. I am an endocrinologist by profession. So I know there is a lot of diabetic problems which are coming during pandemic. So we have taken care of that in institute. We have taught our students, not only students, our general practitioner colleagues across the country to take care of diabetes properly. But at the same time, in our fraternity, some of us started thinking that we know each and everything. But with COVID, I have learned something that you have to de-learn, and then you can learn. And that is true. In COVID, when the first wave started, we started believing that this is a disease where ventilators are a must. As time goes on, our learning changed. Steroid became the therapy of choice. And as learning goes on, we came to know that there is a disseminated coagulation throughout the system. So probably ventilators might not be that much helpful as we have initially believed, though they are still useful, but might not be that. So there is a lot of de-learning and learning which we have done. And apart from my endocrinologist hobby, which I still pursue with passion, what I have learned that I have generated a new interest in infectious disease. Because as a physician, whatever is your super specialty,
So
you are
medicals,
bound to know about basics, because society expects, as what Dr. KK is doing through his videos, the society expects from you the answers, especially in problems like pandemics. So developed a new hobby. Apart from that, as Dr. Chawla has said, honestly speaking, even in institutes, we hardly have a time to even spend some good quality time with the family, or to develop a new hobby. And we have developed a new thing in institute. I do not know how many institutes have done that or not. Especially in first wave, we have developed a multidisciplinary team. And that multidisciplinary team used to take a daily round of 2 hours, and our residents, senior residents, junior consultants who are inside the ICU, they used to give us rounds for all those critically sick COVID patients, and all those patients are discussed. And I tell you, that has made an impact.
Thanks.
That
Thanks,
has
Dr.
made a
Rajput.
difference. Because
So
of our
in nutshell, actually, we all professional, whether it is new hobby or
Yes.
it's old hobby, it is patient related and related to
Obviously.
profession also. It is nothing beyond
Nothing.
Your profession.
So this is the thing which I have learned during the COVID. Thank you.
So now we'll move on to another aspect, actually. How did COVID change our practice, actually? So we know there is an increasing gap between the doctors who have traditionally been trained to do and realities of modern clinical practice. There are recent studies that the moral among doctors is generally declining during this time. And in a survey of UK, we show that almost 54% of physicians reported their moral as a low or very low. And there is also a study, there's approximately, when you talk about the burnout, it is prevalent up to the tune of almost 70 to 80% in professionals. And there is a crisis in staff retention in some countries with a gap of up to 48% doctor considering leaving the profession. So COVID-19 exacerbated these tensions between the medical professionals, physicians' well-being also. So it has been a big problem. So because of the under-resourced medical system, they tested doctors and healthcare workers to the limit of their professional competence and taken a considerable toll on the family and our own well-being. So do you think that these changes are going to be new normal now, Dr. Alok? So these changes which we have seen, we are continuously under pressure, we are apprehensive, we have a feeling of being low for most of the time and feeling burned out. So how do you feel actually? Now this is the time when these, with the mucormycosis and other ENT related subsequent problems also keep you at always on move and always apprehensive about the patients who've been referred rather. This is the first time we saw so many complications, newer types of complications. We lost many patients also. So you feel this is the new normal now, or we're going to have some kind of reprieve in your near future?
So, as we Indians have very short memory, and we humans also have very short memory, I think the things will come back to the normal. It will be not new normal. Everything is reverting back. People are still, the third wave is being expected, but the people are not wearing the mask. Sanitization, yes, people are doing, but new normal, I don't think it will come in our society. But as a doctor, yes, we do, we not to wear the mask in our OPDs unless until we are operating or doing something. But now in our OPDs, we will wear the mask, we will do the sanitization, we will use the gloves. Previously, we were not doing it. So some new normals will definitely develop, but I am afraid that the society will change much. I don't think so.
Dr. Makari, did you and any time sense that the changes in your practice which cause little discomfort or to your patients also, besides family and yourself, so it is really make a difference to your patients also, your approach change, their expectation change, the society as such, our approach is changed. Do you feel that there's some kind of, I think, some kind of inconvenience which has happened into our relations with patients and our approach?
Absolutely. It has changed markedly, and for bad, not for good. Because the medicine is a practice of science and arts. Science we still practice, but arts has gone. The doctor-patient relationship is extremely important.
Yes.
You put your hand on patient's shoulder, patient gets reassured. We don't do it now because of other issues, but that's so important. And what William Osler said, that practice of medicine is only good if you practice like a physician. As a doctor, we can do, as a professional, we are professional, and for which we are paid for. But the empathy you show to your patients or their family, which cannot be paid for. And for that, they fold their hand in front of us. For that, they say, you are God. But that part is going. That must not happen to this profession.
Yeah,
this must not happen to this profession because science is one part, but again, art of healing, the art of talking to patients is extremely important.
Very, very important.
So second thing is that there's a barrier now. There's a patient and the doctor, and there's a glass in between. To protect us, we have put glasses in front of all our outpatients.
Yeah, definitely.
So that glass puts a barrier among the families and patients.
That proximity
That brings
is gone,
a gap between patient and doctor. That's not also fair. It must not last long.
When the physical touch is
as
gone.
we get back to our normal in maybe next year, 2022 or so, but we must remove these glasses between patients and doctors.
Even that holy touch of a doctor is gone.
Absolutely. And third one, that we started giving advice on phone, and this what really happened, that unless you see a patient and examine, you miss many findings. And this really happens because any disease will have multiple symptoms. A symptom is of a benign disease, a symptom of a malignant or serious disease can be found only on good examination. In COVID times, we have probably stopped good clinical examination. So this goes too long now, 2 years now, 2.5 years. It must not come into our practice or habit that we don't examine patient and take a call and or see in the OPD and make a diagnosis, or send for a CT scan or ultrasound without examining patient. So these are some of the things which are bringing barrier between patient and doctor. Therefore, our patient must not be satisfied. Is easy for us to practice because you see on teleconsultation, you see without examining patient. So patient is also happy that they don't have to come to your clinic. They're also happy. Phone kar liya, baat kar liya, and then you get a prescription on your WhatsApp. But we might miss a number of issues by this practice.
Dr. Rajput, did you ever thought this change might affect the satisfaction level of your patients?
Actually, if you talk to me, I totally agree with. We live in a country where social norms are totally different from our Western countries. People feel more satisfied when you examine them physically, rather than just talking to them on the Zoom platform or whatever platform, digital platform. So there is a definite difference in West and East. Not only that, whatever we may say, the most difficult thing in the history of mankind is to change human behavior. Now, what is COVID? COVID appropriate behavior is changing human behavior. In the society where we are living, the behavior which I have learned over last more than 50 years of my life, how I can change overnight. So these are the things which are not going to be changed immediately. So we have to find a solution, alternate ways. And digital for a time being is an alternate way. Now, as far as glass you are talking of, to tell you, we have never put a glass. Throughout the 2 pandemics, I have never stopped my OPD in institutes. The government has not allowed us. We have run all the OPDs, and there was never a glass. But at the same time, we have maintained a distance, and physical examination actually has not been done properly. And it is not only patients, I tell you, because working in institute, you might have also experienced, we have taken examination. Our students, last 2 years, they are not doing physical examination of the patients. So their learning has suffered. It is not only patients. Learning of the new trainees have been different. Not only their learning is different, the method with which they are assessed in examination is again totally different. So this should not last long. Otherwise, we have to design different ways so that in long term this should sustain. Otherwise, this is going to have a great impact. We are producing doctors which have not done physical examination, which has not been examined in a way, ideally they should be examined.
So there are new ways of learning
Yes,
also and
then
practicing
lastly, which I think our colleague is going to answer, there is a huge medico-legal implication.
Yeah, we'll discuss, we'll take that
Recently, because the government and Supreme Court is now forcing that all COVID who have succumbed to COVID, they should be given compensation. So lot of medico-legal issues are going to come. Now, so those things are also to be kept in mind. Initially, we are liberal. A lot of us are prescribing so many things without understanding the medico-legal aspects.
Yeah.
Now, those things are also going to come up.
Yeah. Dr. Chawla, what's your opinion on that?
No, I agree with him, whatever he said.
Yeah.
You see, now with the new Supreme Court judgment, which I think came yesterday, you only
just
told
2 days
me
back.
that if your prescription is faulty, you could be prosecuted. I mean, this will prevent a lot of people getting an online consultation. They should have a middle path. You can't just penalize the doctors, the first, second decision on the doctors.
Yeah, as soon as the judiciary resumed, the first decision
because,
came against doctors.
It is convenient, like a person who's coming from Bihar for a small consultation, he can take a consultation online, but then, of course, there should be a check and balances, but not the doctor would be prosecuted, unless it is a very big mistake.
So now we're moving on to other part, that is telemedicine. We know in order to avoid face-to-face contact without hampering healthcare provisions, the telemedicine, which is now a part of digital health system of various countries and need to be applied more effectively, that's very, very important. Except for acute cases, the chronic conditions, follow-up visit, they all can be managed using telemedicine. And the unnecessary hospital visits are reduced while ensuring triage and treatment of the seriously ill. And the WHO also consider telemedicine as a mode of healthcare delivery when the distance is a critical factor. So this is all new things. So in order to be effective, the health providers should have the necessary education also. They sometimes or licensing also, and sometimes professional capacity to deliver healthcare services through telemedicines also. So we'll take the opinion of experts subsequently. First, we'll take. Given these uncertainties about COVID-19, do you think the telemedicine, Rajesh, is going to be a future way of managing or chronic and follow?
Very convenient. We in Apollo and otherwise, I think all of people in the bigger hospital, they get people from outside. And there are follow-ups where you hardly do anything, which you can do on the telemedicine, and they can come once in 3 months or 4 months. The visit could be reduced. So this could be very useful. And particularly in his branch, they could do a lot of consultation online. I mean, in diabetes and which thyroid, diabetes, because most of the time the reports, they are very important and they can be consulted. So there should be a middle path where what can be done and what cannot be done, that may be laid down, but it should be allowed. And
but we should all learn, actually, our patient also, how to use this telemedicine or consultation for that matter, because it's a lot of time consuming also, and we are basically, they have been not made aware how to approach. There's certain consultation, app-based consultation, but they don't follow the advice, right? Complete history they are supposed to, all reports, past reports, and everything should be uploaded before they consult you.
No, but if it becomes a new norm, patient would also know that they have to upload and what they need to know. And the software will also, online, people in this pandemic, they've really moved forward. And with time, I think this is a new normal, but in a limited manner, probably.
Yeah. Yes, sir.
Actually, if we see for first consultation, whether it's a chronic disorder, and obviously acute is out of question, first consultation has to be face-to-face, where a physical examination is a must. After the first consultation is over and you have put down your proper notes, I believe teleconsultation has a huge role, especially in chronic disorders, whether it is diabetes, whether it is thyroid, whether it is rheumatoid arthritis, because here again and again same physical examination, there is no need. And very recently, Association of Physicians of India have actually brought down the guidelines, because from those guidelines for thyroid section, because I am president of Indian Thyroid Society, I am an author, so we have written all these things, that there can be various things like patient loading their entire reports, so that doctor can review the history, the reports, and then can even give appointment that I will be available 2 days, this time slot. But obviously these things will evolve over time. And I still believe if third wave will not come or will be a milder one, and soon because of vaccination, if we will be out of this COVID zone by next year, anytime middle of next year, then probably all of us will forget the digital platform. Remember it. Everything will be back to the normal.
So there is an urgent need for a system-level approach
absolutely.
to address the issues of the COVID-19, which has created to better protect and safeguard our medical workforce for the future. It's very, very important. So I think telemedicine is going to be so there are a lot of, I think, aspects which we are going to face as a clinician. What is your opinion, sir, on telemedicine? How useful it has been for your practice and your patient care?
I think I completely agree with that the first consultation must be face-to-face. The telemedicines have a lot of advantages, but it also has a lot of limitations. For primary care, telemedicine could be acute care. But chronic care, as sir said, that chronic care is a continuous care. Chronic disease care is continuous care. Certain diseases, diabetes, we know HbA1c, thyroid, TSH or T3 or T4, or free T3, T4. They're fine. But for many diseases, you need to be more, we need to see patients, you need to examine patients. Like, for example, you treat patients with cancer. You need to see patients. You cannot do teleconsultation for such kind of disorders. Certain disorders which could be good, we can treat from distance without seeing face-to-face based on based on the lab reports or something, which are our objective. In diabetes, objective is to keep HbA1c to a certain level. But in mitosis, in cancers, there are different outcomes. So we need to be outcome-based consultation. So teleconsult could be good for certain disorders, and that's, in fact, this is the boon. For example, we see patients with hypertension and say that I see today and see 3 months later. But that's not care of hypertension. You have to see that the BP remains under normal values all through. And for that, this could be, teleconsult could be, there could be different platforms that you type on your phone, my BP today is 120/80, tomorrow 160/90, the next day is 160, say 96. You know that this has to be cared for. If you leave this BP uncared for, then probably we are leaving.
So there has to be balance between both.
Chronic
for the chronic and the regular follow-ups. Dr. Pankaj, we'll take your opinion in subsequently. Then you will speak, we'll all listen. So it's all hanging for you. Your opinion, Dr. Alok?
My opinion is different as far as the telemedicine is concerned in India. It is very effective in acute conditions like in COVID. No doctor was available on the line, in person, and everybody showed on telemedicine. But the flip side of it, one prescription was written for a particular patient, and that was followed by the number of the patients. Irrespective, the other person, the doctor has given what medicines to that particular patient. But that was being followed blindly, right? Over the counters, the medicines is being given. Likewise, the prednisolone or these steroids were misused like anything. So in India, where we have a population who doesn't think that it is mandatory to be examined by the doctor, every patient is a different patient, every disease in a different patient behaves differently, right? So many of us have this COVID disease, but unfortunately, some of them didn't survive, even doing anything.
So it should be a mix of both, actually. You have to select your, depending on but the acute care cannot be given through telemedicine. Acute care is always mandatory, but chronic and the follow-up visits,
visits can be given.
Because you have to protect the medical fraternity also, actually. You never know which patient is a carrier, which patient is going to, because it is just matter of a fraction of second that you get exposed and all. So you have to take precautions also, and you have to take mix of everything, whether it's a physical or...
You cannot just give like medicine on the phone. And in fact, in my opinion, the telemedicine is very difficult one. All right, you take much of the time in first seeing the reports of the patient, then listening to the patient, then answering, then giving the prescription, and after that, taking the follow-up questions.
Yeah, thank you, Dr. Alok. So now we want to something positive, actually. COVID-19, is there light at the end of the tunnel? So there are many speculation regarding COVID-19. For example, Dr. Swati Nathan of WHO recently predicted that COVID-19 is gradually taking the endemic form in India. And there is a speculation regarding the third wave of COVID-19 also. And there are variants of COVID-19 like Delta and Delta Plus, which are found to be more infectious, and patients are falling prey to these variants of 19. And it is also speculated that COVID-19 vaccine may have to be taken every year. And in this backdrop, do you think that there is going to be an end to this COVID-19 phenomenon ever? Or our lifestyle changed, like hand sanitization, mask, social distancing are going to stay forever? Is life ever going to be normal again? Dr. Chawla? So is there a light at the end of the tunnel? How in the future
I personally feel that probably we will not have a third wave that strong. Even if it comes, it may be in spurts, and very soon it is going to take an endemic form.
So it is very assuring when coming on the space test.
Most of the Delhi, many of the people had disease, and now the speed the vaccination is being done, this is going to stop. And probably the trend, the way it is, Kerala is having so many cases still, only in that particular area. But you're not seeing in any other part of India now. And Delhi hardly seeing less than 50 patients. So probably, unless there is a mutation, there is a big mutation which is different, which is also less likely because with time the virus also dies down. So probably we may have just endemic form. That's what I feel.
So anything regarding herd immunity, how we are going to get this herd immunity through this?
Herd immunity is already zero surveys, more than 65% in Delhi.
Yes.
See,
So,
if you
and
see,
the average nation is about 50%.
absolutely, if you see zero surveillance data from entire country, almost more than 50% of the population has already suffered. Over and above, now more than 50% of the population has received the first dose of vaccination. So probably we have already reached the herd immunity.
Yeah, 65%
And,
population,
and,
one
and
vaccination.
COVID is going to stay with us
Yes.
throughout our life. Only thing is that it is going to be an endemic disease, and we have to learn to live with it. And I
because we-
agree,
we
probably
already
third
have-
wave,
yeah.
third wave is going to come, but severity might not be that much which we have seen in the second wave. So it will come in spurts in some part of the countries which has been spared in the second wave, where people are still not vaccinated. There it might come, or children's as, but still I believe, I put big question mark on this theory of children's in India. The reason is, in our country, if one person get affected in the family, the entire family has actually got an infection,
The whole
even if
family
they are
is
children's. So although we are saying our children are not vaccinated, but somehow they have got subclinical infections from their elderly. So I think I agree with him.
Dr. Raj, I'll require your comments on that also. So, up to, because ACE receptor they develop at the age of 11 only. Up to the age of 11, the very limited ACE receptors are there. So the chances of getting through ACE receptor is very low. But between the age of 11, 18, which was the biggest apprehension, because 18 above, the vaccination schedule is quite intensively taken over. Almost one vaccine is given to almost 67, 68% of population. Almost 15 to 20% population in certain places, 35% person had two, I think, vaccination doses. So this 11 and 18 year was basically, you rightly said that if one person exposed during the second wave, the whole family was exposed, but it was not there so in the first wave. Actually, if you isolate, you could actually, you could have confined it to one or two family members also. So regarding this group of 18, 11 and 18, which has been apprehension overall through the many agencies also and the many platforms also, what is your take on that?
You asking me?
Rajesh Shawla.
No, I mean, they have now going to start for less than 18 also.
Yeah.
And till 12, and by the year end for the small children also. So probably, they are going to be very quick in giving, now they are giving almost more than 1 crore vaccination every day. So probably we are going to have this disease and endemic like swine flu. Now we have to think whenever a person presents, particularly in the hospital with a serious illness. Similarly, all our lives will have to think COVID also. It's not going to disappear. It will be endemic. Sporadic cases will keep on occurring all the time.
And probably we have to take a booster dose every year. Recently, just last week only, publication has come up from Oxford University where they have shown COVID vaccination, response of antibody after first dose, response after second dose, and response after third dose. So after third dose, the response is further enhanced. So probably in US, they have started booster. In UK, they are started with booster. In our country,
Israel has already
yes,
completely
in our
given
country,
third dose.
probably it
Yes.
takes some time, but I think by the end of this year, the government is going to take a decision, especially for...
Definitely there is a hope at the end. I think there is
Yes,
a light
obviously.
at the end of the tunnel. I think now we move on to our concluding topic that is very, very important actually. Now Dr. Pankaj is, I think we will highlight all medical legal aspects, how COVID has affected the medical legal aspects. And when you know, in India, the first case COVID-19 was reported on 30th January 2020 by Ministry of Health, Family, where in Kerala. With the Thrissur district. On 11th March 2020, the WHO Director General also briefed the media as operating a statement of COVID-19 outbreak as a pandemic to worldwide. So in the recent literature data search, very few articles found which compromise the ethical and the medical legal aspect related to COVID-19 pandemic situation. Therefore, it is very, very important to evaluate and review the Indian medical legal aspect of COVID-19 disease, such as the Epidemic Disease Act of 1897, the Amendment to Epidemic Disease Act 1998 also, and the Disaster Management Act of 2005 also, Even the Biomedical Waste Management Act also, this telemedicine or teledentistry in the pandemic era also. So these challenges of COVID-19 are huge, but the basic principle of law can keep healthcare personnel out of these medico-legal work. So we would like to, I think, hear from you. If you have any presentations, sir, you can give or we can.
Yes, I have a presentation. If some can quickly go through the presentation. And before the presentation, actually, I'll want to say something about the motivation which I got from Dr. K.K. Agarwal. I did my MD from AIMS, then I went back to my state, and I became yes. Presentation. Okay. Okay. From where? Just 1 minute. So, in 2006, I became the youngest civil surgeon in Haryana at the age of 46. So I was motivated by Dr. K.K. Agarwal. I wanted to give back to my society. So I remember I was civil surgeon Faridabad at that time, and I came with my entire team of deputy civil surgeons to visit his health mela. Perfect health mela ke naam se health mela, he used to do it for 2, 3, 4 days, because usually the concept was 1 day's health camp. And you know what is the health camp? Somebody goes with some medicines, a set of medicine is there, a set of doctor is there. All the patients are treated by that doctor only and with those medicines only. So the concept of perfect health mela was different. It was for longer duration. And from there, I got a clue. My whole team went there and visited the perfect health mela going in Delhi. And then we followed a 5 days health mela in Faridabad, 5 days health mela. The mela started at 6 o'clock with prayers, with yoga, and then sandhyas and other things and all that. And in 5 days, we treated 60,000 patients with all investigations free of cost, MRI, CT scan, like treatments. So I remember that he was really lighthouse. We took prerna, unse prerna lene ke baad we conducted that health mela in Gurgaon. So I had remember some. During that time, I met him personally and took certain guidance also about that particular concept also. As far as this medical legal concept, medical legal issue is concerned, Dr. Rajput has very well pointed out. Then now the medical legal issues are at the top. If you do something good for anybody, you may not get anything in the return, but you do something wrong, then he is after you. So similarly, the medical legal issues, when it comes, who deals with medical legal issue? Police, they don't know ABCD about the health. Judiciary, they are very powerful, so they don't think that they should know each and everything and all that. Whatever you did during all this era will be evaluated by them according to law. Otherwise, see the Epidemic Act, Disease Act. After 123 years, they framed regulations. Usually when Act comes, so after Act, rules and regulations comes in say 1 year or 2 years and all that in the process, but they had 123 years. They took 123 years for the regulations because they need it. They are powerful. They made those rules and regulations according to their wishes, the way they want, and they don't want to do that. See now, medical legal aspects the total it has been masked, the medical field, because various acts, rules, regulations, orders, guidelines, instructions, they have been made applicable. Law made applicable on doctors, clinical establishment, on their working, including treatment being given to both COVID as non-COVID patients. You are not free to treat the patient the way you were doing in your specialty all the way. You are being guided each and every step. And if you use your brain or your clinical assessment, and that does not come in the parameters given by those guidelines and all that, you can be sued. Because with that particular instruction or that particular guidelines from the Government of India or Ministry of Health and Family Welfare, and whatever treatment you can give, that goes, the judge will see, the interpretation goes in the favor of that you have not done this thing. So they have masked each and everything. They have told us what investigation is to be got conducted. RT-PCR test, or this test you will get it done. Other tests you will not done. CT-PCR test you will do or you will not do it. So all these things has been taken over. Even immunization has been done. क्या इस age group में करेंगे, इसमें करेंगे, नहीं करेंगे, क्या करेंगे, now so many limitations are there. It has affected doctors, paramedical staff, clinical establishments, even our professional ethics, treating procedures and diagnostic parameters. Nothing is free without medico-legal aspect. See, even medical death certificate, the quality of information in this has become very crucial. Even the case is pending in the Supreme Court because you never bothered. You just write down what is the cause of death because you are suffering from this thing or he has got a heart attack or whatever like this. But now in this, whether he has died of corona or not, whether that has to be mentioned in the certificate or not, death certificate, that information has to be given or not. It is moreover like in earlier stages when we have to declare somebody a patient of cancer. So it was very board will sit and so many things will go, and then we used to say it like this. So now cause of death, whether it is due to corona or not, it is a very Herculean job because the financial implications are there. The government is giving compensations for dead people or for the kids whose parents have lost their life. So that's why it has become very crucial. Even PIL has been found. So when you write the cause of death, you have to be very, very careful. And if you say it's due to corona, then you have to justify it. Because as per government instructions, only the RT-PCR test is positive, then only you can say that he has died of the corona. If test is not positive, you can't. Even your CT chest and other things, and you treated the patient for that. For your board of doctors has treated the patients for that, but you cannot declare it. So now the PIL has been put to the court. In Supreme Court is pending. I think the decision is going to come about that. They will guide you. They will tell you how to write a report, how to write a death certificate. And we doctors usually don't bother about those particular things because we are clinical and we always try to help others, but this can lead you to trouble. For example, you have written that he has died of the corona. He is asking for the compensation. He went to the government is not giving. He will go to the court. Then you will be called again there as a witness. Then you have to justify in front of that particular court again. So all those things, those guidelines has to be treated. So even that has become very crucial. Even management of corpse, pandemic has become a very vital issue. Because suppose if it's in a small nursing home or a clinic, if patient comes at the end, fake end, when he is very serious patient, and suppose he died there, and you know it clinically, and from the history, that is a patient of the corona. So now you are in dilemma whether to declare it or not. Because once you declare, then you have to follow all those protocols for the management of the corpse, which your nursing home or clinic is not having those particular facilities and all that. So everywhere, the medical legal aspect has come. I was telling about this Epidemic Disease Act. It was 123-year-olds and the regulation has been formed. It is applicable now. Indian Penal Code has become applicable on you. Disaster Management Act of 2005. There are so many government notifications. I was calculating there were 480 notifications from January 17 till April 19. After that, I started, I'm not counting the notification which has gone on that. How many of you know about these notifications? I don't think anybody of us has gone through any of the notification carefully about this. But every notification do impact, do have medical legal issues on our treatment, on our judgments, on our, they can create litigation positions to us. See, act is different. Then they have the powers, they have the orders, they can, by various state and by various local authorities. Even local authorities are passing so many orders and all that which you don't know. You don't know, those orders passed by district magistrate or this sub-divisional magistrate doesn't come to you. So you are not aware of about those notifications and all that. But once the problem comes, that notification can create a problem for you. Then guidelines issued by WHO, medical boards, regulatory authorities. You are saying it is not a repetition actually. Everything is important. Like rules are different, regulations are different, instructions are different, government orders are different, instructions are different, guidelines are different. Everything goes on your impact. Now, after 123 years, Delhi, Haryana, almost every state has made these regulations to 2020. I don't believe hardly anybody have read this regulation, hardly. It has got a lot of implications on your career. You have to go through it. There was an act, PNDT Act, if you remember. In PNDT Act, several thousand doctors has been jailed. And act is very small. Even these epidemic regulations are very small, say 5, 6, 10 pages only. But nobody has read it. Even read it once, they cannot go through those particular things and all that. So according to it, during COVID period, any patient comes to you, you must have a pro forma of self-declaration. Because if you don't have those particular information, if there is a proof that he came to you and after a few days he went somewhere else, he is a corona positive case, and something happens, then things go back that he came to your place also, and you miss this thing, you have concealed the facts from the authorities. So this regulation has become very, very vital, very, very important. Now, very important thing is that you must have heard, kabhi suna hi nahi hoga, socha bhi nahi hoga, you must not have ever imagined. Then a sub-divisional magistrate or a deputy commissioner can acquire a corporate hospital. They can acquire not only the corporate hospital, the building, they can acquire the whole staff, the equipments, everything. And then they can give it to civil surgeon to follow it up. You must have heard about it. Even NCR in Gurgaon, 6 hospitals were taken over by a simple order. And you know what act was used in that? There is an act called as Haryana Requisitioning and Acquisition of Immovable Properties Rules 1973. 1973 में, as per this act, हमें याद हम पल्स पोलियो के प्रोग्राम में, during pulse polio program we needed lot of vehicles. So during that we used to go to deputy commissioner, and deputy commissioner can send a letter for requisition to the police that so many vehicles are required. और पुलिस वो vehicles लाकर हमें देती थी, गवर्नमेंट के जितने vehicles होते थे उन सबको एक्वायर कर लेते थे. लेकिन never heard that the whole hospital can be taken over with your staff, with their equipments. Such an order, Delhi Epidemic Act में आप देख सकते हैं suspected COVID-19. अब now Delhi Epidemic जो COVID regulation जो act है उसमें what you have to do is, if a patient comes to you, you have to take history and declarations from him, contact history, and you have to declare. So time is less. I am quickly going through that particular things. दिल्ली एपिडेमिक के चीज हो गए, सारा हो गया, या पार्ट देख लीजिएगा, इफेक्ट ऑफ मेडिकल फ्रेटर्निटी. And now, what I want to say is that through this August office of Dr. K.K. Agrawal, through this, we can think that if doctors' medical fraternity is at stake, there should be certain guarantees should be given to us also, to doctors also. Like in these acts, in all these acts, there is a clause. By that clause, if any officer or any state government or any authority does any work in good faith, so no action can be taken against that officer or that authority or that government. So we must insist on the government that during the execution of this epidemic act or this disaster management period, whatever act is done by doctors or by big hospitals or nursing home owners, then that should also be treated in that particular category, and no suit should be launched against the government. So Section 4 in the Epidemic Act, then Section 73 in the Disaster Management Act, no suit of prosecution. That's why in Andhra Pradesh, 58 private hospitals were taken over by the government authorities during this particular power. Yeah, this is the order which a magistrate has passed. Simple one-page orders, half-page noting, 7 hospitals were taken over by the government. These were the hospitals: Metro Hospital, Narayana, Signature, V. Pratiksha, Columbia and Park hospitals. Now, my recommendation is that during this epidemic and when these acts are there, the government should give professional indemnity insurance to all the medical and paramedical staff and the hospitals. Second, this protection, which I referred earlier in various sections, they should be doctors, paramedical staff, and hospital managers. They should also be included in that category, that anything done in good faith should not be there. No litigation, no suit or legal proceedings shall lie against any treating doctor, owner of clinical establishment for treatment given or action taken in good faith during these periods. They should be given relief from prosecution of alleged grievances of patient for non-compliance of provisions of Consumer Protection Act, National Medical Commission Act, Indian Penal Code, Clinical Establishment Act, even this Biomedical Waste Management Act. Rules, because they are also working in extraordinary and exceptional circumstances. So these are the recommendations which we can do it. Thank you. So nice of you. Any questions I can.